What is health research? Health research helps us find new ways to treat and cure diseases. Health research helps all of us live longer, healthier lives. And while we've been able to discover so much, we can still do better. Let me give you an example. Imagine you were looking for something in the dark with a candle. You'd probably find it eventually, but wouldn't it be easier if you had 1,000,000 candles? The same is true for health research. The more data we have, the quicker we can find what we're looking for. Enter the All of Us Research Program. We want to help advance health research by creating a large health resource. How big? 1,000,000 people big. By having access to the data of 1,000,000 people, researchers can discover more about our health, and the possibilities really are endless. Here's where you come in. By sharing information about your lifestyle, environment, and biology, you can help empower the medical research of the future today.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better, until now. Enter All of Us, the research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1,000,000 people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1,000,000 people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
The All of Us research program is an ambitious effort to gather health information from 1,000,000 or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
Good evening. Tonight it's just very coincidental that we have in the panel just two individuals. And I'm very, very glad that not only in the past we used to have men and we have women in the field. And that tells us that how research, how things have evolved. Historically, when people are looking at society, we have the dynamics of evolutions, and sometimes you have to talk about innovation. And all these two concepts, in order for you or for humans just to play around it, you need research. And to have research, we need interaction. We need participation. We need people to engage. Historically, in this great place that we call America, sometimes we haven't seen the ethnic group just participate in research. And sometimes you ask yourself questions, why? And tonight, we want our just to engage in this dialogue, just to understand better. And it's not just us going to talk about it, it's you. Make sure you wear your hat of researchers as well. We are going to pull out all the institutions behind research, but people are going to engage as researchers. And my name is Dr. Cayemite, and I have Dr. Jean Bonnet and Dr. Aditi, and we are going to talk about research, and I'm hoping that you will do your very best just to be a researcher that you are. And again, thank you very much for coming, and it is a pleasure. You're so beautiful. So let me pass you buttons, and can you tell us about yourself?
Thank you. Yes, it's a pleasure to be here. My name is Aditi Hazra. I'm a cancer genome scientist, and my expertise is in breast cancer prevention and genomics. I have trained in my PhD in cancer biology and then moved to Boston for my postdoctoral studies at the Harvard Chan School of Public Health, where I joined the program in molecular and genetic epidemiology. I contributed to genome-wide association studies and functional genomics research. Today I'm an assistant professor, and as a scientist I ask that too many of us know someone who has suffered due to cancer or the treatment of cancer. The question I want to ask is, what if we could prevent this suffering? And so 2 research projects I'd like to share with you to illustrate that are one on precision health equity. So 1 in 4 breast cancer patients are diagnosed with what's called DCIS, a very early stage lesion. These will not all progress, but some will. So some women will receive overtreatment because their lesion would not have progressed. Other women may not receive comprehensive treatment. And African American women are at higher risk, but they are understudied in genomics research. So to address these gaps, I designed a study to collect the patient's medical data, the clinical and lifestyle factors, as well as their tissue specimen from their DCIS, and we'll measure the RNA levels and create a mathematical model together that can help us decide who will progress to invasive cancer or have a recurrence and who will not, so that then we can be using precision medicine to tailor the treatment to the individual and their situation. And to enrich for diversity, I'm partnering with my collaborators at Washington University in St. Louis, which has a diverse community, and we will include African American patients both in St. Louis and here in the greater Boston area in this study. My second study is called STARS, and it's on strength training and research for survivorship. So we know that physical activity is good for us to reduce our risk of heart disease, cancer, diabetes. It also improves survivorship in cancer patients. But most of the studies have looked at aerobic activity. So you're counting your steps, you're walking, you're running, cycling, and not many of studies have looked at strength training itself. And the second is that most of these studies have been, for breast cancer, have been done in white women. So I wanted to design a study with the Boston community as partners that includes women of color and is an inclusive study where we can study the benefit of strength training on body composition, quality of life, as well as cancer survivorship. And so this is a study that I am designing now with engagement from the community, and I'll talk more about that.
Wealth of information. So I'm glad that you are coming. Thank you. Sir?
Wow.
I think I know too much about you.
I think you guys, I heard a lot in a short period of time. Look at where we come from and look at where we are now. As we discussed prior to that, all the research that was done on 80% of Caucasian, but it was one size fits all. Whatever come out of that research, it's what they give to the blacks, to the Asian, and to the Hispanic. Some respond, some do not respond. Post-marketing, we find out sometimes the side effect could be worse in some group versus another, and the response is not really identical when you quite compare all the groups. Now, that was the first curiosity, why this one not as, why not on that one? And talking now about in different level, genetic, but also genomic, looking how, what kind of response, how you metabolize things, what is the difference that you have between this and the same ethnic group. They could find out the difference because everybody is different. And now they're shifting to individualized medicine. You heard, given our specialty, how they use the genetic component to really treat people. But if you treat that group of people, would it be responding, that was a group responding the same? Not necessarily. They go back further in treatment. They could manipulate the genome to provide better response. Now, where are we, the ethnic minorities, giving this? Giving this advance of medicine, we cannot and cannot afford to remain on the sideline, because the treatment should be designed for you, specifically for you. So if you're not part of it, you lose the game. You're not in the game. Now, tonight, this being understood is not that easy to enter to the ethnic minorities, because as we know, as I said last time, they're living to an island close to the mainland, not necessarily having the bridge to the mainland. And every single group, as we say, we're not a melting pot, we're a salad bowl. And each component will be different. As I point out, even before you go to the genetic aspect of it, culturally, we would say the Argentinian as Latino is not nothing like the Dominican at that level. But now we're going a bit further, talking about that specificity, that person itself, individual. You see how important it is right now. So we must find a way for the ethnic minority to participate in the process. But I usually say it's not possible to develop a good health promotion program without the participation of people you're going to serve. And they cannot participate in the process if they are ignorant of the facts. So we have to educate our community. I think she just gave you, I don't know, a fantastic, talking about those research, those two programs that she's running right now. And you find out how important it is to be part of the process. So as a community, we all different. We got our health belief, we got our cultures. As I said, the ethnic minorities, when they leave their country to come to America, they bring with them their laundry bag. And that laundry bag, not necessarily washable by the first generation, sometimes go to the third generation. But if we understand it, if we could penetrate into that bubble and using the proper message by the right messenger, so we think we'll be able to easily navigate and bring them in, integrate them to the process. But why I'm to say that? The community has to play a role. We're talking about research. I made designs that and said, good feeling, heart feeling, said, okay, that's the way it is. I got my experience. No, that's not research. We cannot talk about research and impose research come from you guys, from the community, from the respondent, and this is what we're about to do.
So that is really, really good, and we understand two dynamics from your talking. The framework of resistance, that we've been there, we have seen it, we understand it, and at certain point in research, it seems that people still questions the framework of equity, the dynamic of capacity, and some group stop and they resist. And you said something that bring me to my knee and to ask probably to say more. It's the framework of what if we can help. Yes, we resist. We read about what's happening, but we need just to increase the rate of participation of the ethnic minority in research. And can you elaborate more on that what if framework for me?
Yes, I think there are many ways the community can help. To design STARS, my strength training trial in breast cancer survivors, I spoke with physicians and healthcare providers at different hospitals to get their feedback. Then I spoke with patients, and feedback that I received from breast cancer survivors in a community advocacy group called Pink and Black transformed how I was going to do this research. They gave me feedback on what they liked about the goals, what they liked about the design, what they thought I should change, and that was transformative. Their voices were heard, and I made the changes. And these were women like you and I that gave me feedback. So we can all be citizen scientists.
So do you understand, sometimes we could preconceive idea and say, okay, there is a really that dichotomy between academia or corporate America and community. But researchers, when in her case, she understands, okay, if I'm going to do research on this community, I cannot do without them. She hears from them, from their healthcare providers, and from the patient themselves. And that allowed us to do things differently. So that means your input, your participation, your discussion on all this, not only will shape research, but also policies. We know healthcare system is very politicized, and the economic is this big thing. So if you don't participate, then they're going to impose. But if you participate, you could look at all the aspects of it, because your life depends on it. Not only on the researchers, but policies they're going to make about X, Y, Z, because it does not remain at the research level. When they're going to implement, then will become the healthcare industry and all facets. We're talking about interest, we're talking about pharma, we're talking about all those got to stay. So participation is to be said, not only there, we have to participate to understand. So you could change the format, and hopefully you will get the health, that disparity that we're seeing in healthcare, that inequity that we're seeing, that cannot be changed without you guys. You have to be part of it.
Bonnet, as a social researcher in academia, I looked at sometimes that we do research and sometimes we don't even know the community that we are going to do research on. Or we might have a clear concept of the framework and we have the right methods, but not knowing your community that you are going to engage will probably hinder you from getting the right outcomes. And oftentimes in my own study, I use a frame that we call feedback loop. what does it really entail is simply, oh yes, I just engage my community and my participant, and they give me ideas, and I process their ideas, and I went back to them again. Just say, well, is that represent exactly what you were telling me? Because we're supposed to be in a discussion together. But in medicine, it seems that it's sometimes you don't really have that luxury just to do that. And tonight we are about just how to understand and find out from you as researchers to lead us, to give us some key concepts or probably some strategies that we need just to look out for future research. Because the main thing that we are seeking about, the main thing that I really want to do is to increase the rate of participation. Because Bonnet stated that 80% of research used to be done on the Caucasian. But unfortunately, most of the medicine, you will take the medicine as well. So what if the medicine is not that great for you? So you will see the side effect. And that will cause more harm sometimes from you taking the medicine. I do believe these researchers, they have the good intent. But if we refuse to participate, well, I think we have our part. We need to engage. And I know your studies, I know your research, I know how you work with your patients. And sometimes I say, well, my big burden is just to be a heavy researchers, because it will take time just to engage with patients. And I do believe we have that aspect in research as well. What do you think?
Yes, so I think there's two components. One, as I discussed in the STARS example, partnering with the community. And then the second is to partner in the community, to meet the patients where they are, to engage them in their setting and with their healthcare providers. A few examples of how all of us is doing this. They are developing radio ads, TV ads, ads on the T, on the bus, to bring awareness about the studies to where the participants are. And a great example is the Journey Bus, which specifically will be at the Boston Public Library in May, and will provide a hands-on activity as well as opportunity to learn more about precision medicine, exactly what you discussed, that for any given drug, some people will have a benefit, some people will have a harm, and others may have a side effect. And what we want to do is to give the right drug to the right person based on their genetics, their lifestyle, and their environment. And we can only do that if we can first study the diversity that reflects this country.
Many times we are doing research and we are looking for the sample for the population to do research on or to do research with. That's a new language, and thank you. And without, involuntarily, sometimes we just left some people behind.
Yes.
And we know technology is moving. Technology is not staying at one point. It's moving up, right? And I've heard that people are doing taking questions or doing surveys online, doing just using apps just to collect data. But unfortunately, within that great society that we are talking about, well, there are people who still don't have access to that great technology that we are doing.
Yes.
So at some point, I think we really need just to go to the people,
Yes.
as you said.
We need to go to the people to understand what the barriers are so that we can address them. So if I learn that a barrier is transportation, then we work to find a gym in the person's neighborhood to see if we can coordinate with the YMCA in that region. If we learn that the barrier is having internet access, then we will put the videos for exercise on a USB drive and give it to the participant, or on a format that they can access. If I learn that a barrier is not having a Fitbit, we are giving Fitbits with the study. So I have to know what the barriers are, and then I can work with the community, with my study team, to see if we can address it together, if we can come up with a solution that enables the community to participate, because we want people to join the study, but we also want people to stay in the study. And they may not stay if they don't like something about it. But if I hear the voice in advance, then we can make that correction together and design a study that reflects the needs of the community, that answers the questions that most benefits the community. When we study inclusive populations, we create benefit that is shared across all populations. We all benefit. An example is of a genetic study that was done in a West African population, and that diversity elucidated more about the biology, led to a new class of drugs to be developed that now is beneficial for all races. So that is the benefit of participating in studies, to having your lifestyle heard, your genetics measured, and creating benefit that allows us to prevent and treat disease in your community in the future.
Well, I really like it, and it's a different era. Different era, they're not based only on the bio. Yes, the great advancement of genetic and looking at it. But now, if you are taking account your environment, all your psychosocial, because all what could get an implication in your life. And I usually say to people, everything also in society you don't take care of, end up to medicine. Homelessness is a medical problem. Unemployment is a medical problem. That illiteracy is a medical problem. We know from talking about illiteracy, that's a medical literacy. But 78% of people may have different in their prescription, they don't know how to read it. And therefore, they become non-compliant or could affect themselves because they don't have the know-how. We assume that people are most of them at our level. And therefore, that sounds quite easy, but that's not necessarily the case. Being a provider in minority community, I got so many examples. I got patients admitting to psychiatry and the psychiatric floor because of their health, because of their belief, religious belief. And they think those people are psychotic. Why they're not? It's because why they believe. So now we come to the point, the provider has to be more culturally competent, or asking, clarify, not assuming, not pretending. So now we're talking about partnership and medicine. And we know those patients are under bubble. We go to them and learn from them how, and that's how we could serve them better. This, regardless of the advancement of the bio, the genetic aspect that we are now in new frontier, but if we, the psychosocial, integrate those people to the process, we're not going to make a dent of the health disparity, health inequity we are seeing in this country. Because sometimes the disparity is so huge, and we're asking ourselves, are we living in the same country?
Yeah.
So, but it's up to you to participate. You cannot save someone without themselves. They have to be part of the process. That's the reality.
Maybe from both of you. If we are talking about just the framework of integrations and framework of participation, and we are looking at the cultural affinity or engage people and educate people, and you need to be flexible, right? And you have just to go to the bare bone of our community, just to make sure that your research completed. But how willing are you just without changing your methodology. Because sometimes you might just go too deep and your methodology simply change. So how are you, what is the willingness of you to, in your studies, that you are trying to engage people, but without causing harms to your methodology?
Right. So we want the methodology to be rigorous so that the results that we provide are robust and accurate. So we need to study a large number of people to become more precise and more accurate. We also need the research to be following IRB guidelines to make sure that we are benefiting patients and communities and not inducing any harm. So that's the first priority. And so within that, I think the goal is to develop a protocol, and then you work with the team and the community in the design of it so that once it starts, that it can be followed in a rigorous manner so that you can accurately report those results and then learn what needs to be changed in a future study and how to improve the methodology. But we want to be rigorous in conducting the research, and we want to be rigorous and robust in reporting those results.
So therefore, lots of education needs to be made.
It's a lot of. It's not a one shot deal. He has to get. So we, as this is a 10 years, I'm not really part of the design of all of us, but I think for to be very successful.
But remember, it's the research is not just about all of us. It's research
in general. Yes, I'm sorry, but it's that means we have to get a campaign not only here, where we got an elite and selective as an audience, but we have to go to the church, to the grassroots organization, and using the language and the graphic manner so that person who got elementary level could understand it, and people could understand everything. You must find a way to translate it graphically, because sometimes when we're talking about very advanced like genetic, talking about the genome, so how I'm going to make that person who's illiterate, who's not having, if it's all is have belief, to understand that aspect of it, so they could really to the point to participate, because you cannot tell them just come and take the sample and participate. They need a good understanding of what's going on for them to become. That's the way you're going to make the will change.
Yes.
But isn't it true that Bonnet, research or studies cannot be in a silo, right? And I just heard you mention about churches, going to church, and oftentimes people really use it. And in some ways, and I really want to have a better understanding of it, right? As a pastor, and here I am, I need just to preach to my flocks. And now you come, you researchers, and you really want me to engage my people in study. And the question is, what's in it for me? What do I get out of it? And why should I expose my people just to studies like yours?
First, I think it's why we're talking about the message and talking about the messenger.
Mm-hmm.
If you got the right messenger, the message will go through. Let's say, for example, I speak Spanish, but it would be very awkward to go to the Spanish community without another colleague. I could go with a colleague, a Spanish physician, or whatever, to go to the community. But if I go on my own, culturally, it would be like a disrespect. So I think if you engage the pastor first, and the pastor happen to understand what's at stake for the population, that's not him. That's way bigger than him. We're talking about transformation of this and for mankind. But for him to participate, he cannot stay beyond his own selfish view when he understands the implication, where that's going to bring us as a whole, I think you'll be able to have a good messenger to carry the message.
I love the holistic approach. What about you?
It was brilliantly said. I would just agree that first would be to develop the relationship with the pastor, with the community, and then create a message that it is on the researcher to be able to explain the complex designs of the study, the complex value of the study, to explain what genome editing is. We can use diagrams, animations, and explain to the pastor, to the community, to provide a direction to the members of that community. So I think relationships matter, building trust matters, and working together we can achieve that.
So it seems that you are calling, or you are begging for, or requesting collaboration, right? Because oftentimes I've seen, there is a dialogue, so it's a continuing thing between myself and some of the physicians in my community. And I always tell people, well, they are the best. They are the ones who knows the community, because they talk to them and they took care of them. But sometimes we come out to a community and we don't engage the local physician. So I've been telling other researchers, it is time. It is the right time just to collaborate and to engage these doctors, these physicians in research. And I don't know, you have so many studies that you are doing, and hopefully you engage some people in your community as well.
Absolutely. My first step with STARS was to engage the physicians at Boston Medical Center, and similarly for the study collaborating with WashU, I'm engaged with the pathologist and the leader of the study there. So we have collaborations. I think that is the key to the future research, because no one hospital may have enough diverse patients. So we need to collaborate across cities, across states, and across the US to really reflect the rich diversity of this country. So collaboration is key.
Okay. I think is also the general population will able to absorb it, to understand. Soon some diseases that you call non-treatable, with the manipulations, editing of the genome, you will see soon the cure they will bring to some disease known, which could got the longevity of people could, let's say, for example, sickle cell. Soon you will hear more about what we do with diseases like sickle cell, because now they be able to enter in that genome, make the change, either for has been or treatment. It's so fascinating what's coming in, and you cannot say not being involved to understand, because I usually say your health is your wealth, regardless how much money you gain. If you're not healthy, the situation is not the same for you. So if nobody goes to the bank for you, if you pay your mortgage, you know what you have in the bank. You don't let anybody to sign your checkbook. What about your health? You don't want to be part of it? Now there is a way to explain that to you. Take it on your own, your health, understanding, participating. That's a different era. I'll tell you, you cannot stay on the sideline again. We need to participate, but need also to be educated on the matter.
I don't know if I still have time, but I have a lot to say about this process of strategies, right? You mentioned, and probably during the first show, that medicine is about economics. It's about education. And research is all economics as well, name recognition. Now, I am the layman, and you want to do research on me, you want me to participate, you want me to engage. But at what cost? Who's going to, yes, I understand my benefit, just through healthcare at certain point, you will develop a big medicines and that will be beneficial to me. But if research is economics, what do I get? What do I get from that economic dynamics?
Everything is economics. If somebody says money is not part of it, you're living in a different world.
Okay.
It's part of it. Once you have an idea, okay, you think about it, you put everything in shape. By the time you go to make the application, that requires money.
Mm-hmm.
You need money to execute, money for everything. And money is at the basis of everything on this planet. I don't know in different, not when to go above. But on this planet, whatever you need money. But for those of us, if you're not participating in the process, you cannot benefit from it either. Last time, the question I did ask to Dr. Julian then, actually not asking the question, this was my concern. I said, okay, this study, which is probably bringing to the other frontier, is really sponsored by our money, NIH. But soon, once we get on the other board of the frontier, we know everything, we're going to implement. And the implementation, sir, that's the way we work for this country, we're going to get private sector to be involved. Corporate, pharma, researchers, and all this. Now, regarding to the costs, we have found out where we're going to fit the ethnic minorities. We know cost of medicine. How that going to really affect us? The only way not to affect you, you have to participate. It's what I said, participation, you understand, and you could switch policies, because not only the medication, whatever, defined, we'll get policies about it. It's political. We know what medicine is about in this country. So if you play a role, so when for this, they're going to write different policies and all this, you participate. And this is how you're going to also benefit from it. That if you've never been part of it, you cannot complain. You cannot say it, because that will be a starting point for you. So to me, let's educate ourselves about the matter. Let's participate, because they cannot use somebody else for you. Whatever they receive, they achieve is individualized medicine. You must have all the tools to go to you to protect you for now and the future. So not only you, but your generation to come.
All right, Dr. Bonnet, I only have 2 minutes before we close out this series. But I really want just to go to you. Same questions, but with the lens of the pharmaceutical companies.
Sure.
And what can they give in return?
So in addition to benefit sharing for your community, there's also the data sharing component that the research is engaging in. So for example, in STARS, I would like to give back the data on body composition and some of the biomarkers to the participants at the end of the study so that they can be empowered with that knowledge, empowered about their own health. Similarly, in All of Us, they are also returning results and returning value to the participants so they can be empowered for their own health. So that, I think, has a great benefit and value to the individual and their family to be able to have that data. And I think another component is that some studies do have some small gifts that they give when you complete certain parts of the study. So either you get to keep the Fitbit, or for coming in and doing the physical assessments, there may be some gift that's given to the participant for their time. So these are all sort of built into the research infrastructure. But I think the greatest value and benefit, if health is wealth, and it's having the health data back to the participant is a key component to empower health, to empower healthy living.
Well said. So on that note, just going to give you just a little break. You've been so great to us listening to these two giants talk about their research, their studies, and their practices. And later on, it's going to be you. You're going to be the researchers, and we're going to be at the receiving mode just to get your info, because we are looking for strategies, because we really need to increase the rate of participations of the ethnic minority in research. Just stay tuned. We'll be right back. And you can stand up and have a little stretch, because I believe I need that as well.
Health research helps all of us live longer, healthier lives. And while we've been able to discover so much, we can still do better. Let me give you an example. Imagine you were looking for something in the dark with a candle. You'd probably find it eventually, but wouldn't it be easier if you had 1,000,000 candles? The same is true for health research. The more data we have, the quicker we can find what we're looking for. Enter the All of Us Research Program. We want to help advance health research by creating a large health resource. How big? 1,000,000 people big. By having access to the data of 1,000,000 people, researchers can discover more about our health, and the possibilities really are endless. Here's where you come in. By sharing information about your lifestyle, environment, and biology, you can help empower the medical research of the future today.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better, until now. Enter all of us, the research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1,000,000 people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1,000,000 people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions.
Here we are again, and welcome back. We have these two giants in the research frame, and as well as practitioners and community. And definitely, we are here just to know about strategies, just how to do the best research and to engage the community in research. And Aditi, I know you have a lot to say, and you have run so many studies and research. Can you just tell us more about your studies and what you have done?
Sure. So the first step in studies to engage the community is to build awareness, to go out into the community. And I've done that by giving talks in the community with advocacy groups, with different community groups in the libraries, churches, as was mentioned. All of us is also doing several of these strategies by going out into the community and giving awareness also in places that participants may be, such as the T, the bus, and advertising on the radio, television, engaging in community conversations, as well as in neighborhood newspapers to inform the participants. And so that's really the first step. And a great study that a colleague of mine leads is called the Metastatic Breast Cancer Study. And they used Twitter to engage participants, to recruit participants. And it was very successful, where one participant would recruit another and say, I joined this, and retweet, you should join this. So it got the word out, word of mouth from other participants. So that's a very great patient-centric example as well. And I think just first starting with awareness, that's the first step.
Okay.
Well, I think I almost don't have much to add, because I think we hear it in the sense I think it's about time to see anything different.
Can you believe we are living at the age of technology, and whereas people are tweeting, and as I'm a technologist as well, but sometimes I resist from tweeters, right? I try to stay away as well. So in that domain, what if you are using tweeters, right? What about the older population? How do you reach out to them?
So the metastatic breast cancer study, led by Nick Wagley at the Broad Institute and Dana-Farber, reached out through a variety of mechanisms, of which one was Twitter. So it wasn't confined to one hospital, one geographic location. It was to engage participants all across the U.S. And that was one mechanism. Email, internet were also involved, and they could go to the website, click to join, to count me in, and that's how they could find out more information on the study. So it does need internet access today to be able to join that, but it reached out to a very diverse demographic, age and race distribution-wide.
Yeah, I would love to see a group of researchers going to Madison Square, the great arena where multiple and diverse languages, and just reaching out to diverse population. So I will count you in, brother.
So actually, with the Dana-Farber and Karen Burns-White and Dr. Latrice Landry and Paulette Chandler, we are going out to the communities. Mattapan is one of the locations to talk about precision medicine, what it is, and how people can learn more about it. So we are actually doing that. I'm giving a talk at the Roxbury YMCA on Monday, and we're doing a series of these talks for April for Minority Cancer Awareness Month.
So it's a field that I heard you're talking about, well, just that filter and that left ears, right? You are coming to how many churches? We have so many churches in Dorchester Mattapan area. So I would love just to say that's probably one of the strategies, right?
Right.
Just having you guys are coming to the churches, right?
Sure.
Okay.
But you're talking about this on the second and the first generation. There is also a buffer, is their caregiver, because most of the time you cannot reach the old populations who first come here 30, 40 years ago, and they remain in their bubble. They are not living in this country. They're not living in this country. They're living back home with their mind. But their caregiver, their grandkid and kid, who are looking at this aspect is also a medium to really reach out to them, because most of the time those people depend on their kids or their grandkids for their care. So therefore, if we could reach out to their caregiver, that's another filter where you could fit directly to those patients.
Sure.
Yes, I know it will come time just probably for 3 to 4 minutes just to talk more about that dynamics of strategies. And I'm hoping that you are watching and you are in the audience. Definitely you took notes and just you have your questions and you have ways just to tell us exactly what's lacking and what do we need to do as researchers to engage people in the community and to engage our people in research. We do count on you and we need your help. As you heard that 80% of the past studies they have done on other group but you. And this time I want you to be counted. I want you to be in. I want you to be researchers. I want you to be in studies. And I'm waiting for your questions and or for your participation. So the floor is yours.
Hi, good evening. One of the things that Dr. Bonnet had mentioned when he talked about the importance of being who the messenger is for the study, we find that I think there must be a correlation between the number of minorities in research studies in addition to the number of minorities who are research administrators. And so how do you all as administrators, because I think you all are in the minority if you're an administrator who is an administrator of color, how do you suggest that health and healthcare professionals and leaders bridge the gap between the number of healthcare administrators of color so that we can increase that number in order to increase the number of participants as well? Because we know that culture and language is what will lead to a greater message for the community. And so if we're not seeing people who have the same culture and language that comes in, it doesn't translate as well, which is what Dr. Bonnet, I believe, was saying. But it's hard when the majority of the administrators are not people of color. How do you think that they should manage that?
That's an excellent question on the importance of diversity inclusion, both from a race, ethnicity perspective, but also I could speak to a gender perspective. We know that women are entering medical school and graduate school at almost 50% rates, but a recent study that was published in The Lancet showed that among the researchers, women are only 31%. And I am an assistant professor, so as people move through the ranks, that the percentage decreases. And then if you add race to that mix, there's an intersectionality and it further decreases. We are, as in a university, they are trying to improve the diversity and inclusion, but you're right that we have a long way to go and we have to make academia more equitable. And we are all trying to mentor the generation that we have as students, to not only mentor but also sponsor individuals, to give diverse individuals an opportunity to rise and lead research.
What you just said, it's really mean a lot. So we have another question.
Hi, my name's Julia. I think.
Yes, okay.
I had a quick question. Thank you for women's health and about breast cancer. I really love that topic. Now, what are some of your exclusion criteria for both of the studies you're doing? I heard a lot of inclusion criteria for the patients, but what are some of the exclusion criteria that you're looking at?
So I'll start with the exercise trials. So we are targeting women who may not have had the opportunity to exercise before. So perhaps if you're a world-class athlete, we would exclude you because you may not benefit from an introductory strength training program. If you are currently in active breast cancer treatment, then it may not be the right time to join. So we are looking for those who have completed their active treatment and are post that time in their survivorship. In the Precision Health Equity Study on DCIS, the very early stage of breast cancer, it's a retrospective study, so that means these patients are already in the hospital records. I'm looking backwards in time at their records. So we are identifying those who progressed and matching it to women who did not to be able to compare the key differences in genetic and clinical factors. So the inclusion and exclusion criteria is dependent on who we identify as cases first. So those who developed DCIS and then progressed to an invasive cancer or had a recurrence, and then matching based on those characteristics to women who did not progress. Thank you for your question.
Why, if I would like to participate, what is, for research, what is the formation? Do you have any class that you gave, or to help people like me to participate? I don't know, like someone that don't know about research. I'm just give myself as an example. Sure. So that, like some people that just heard about it, just hear about it, they want to participate, but they don't understand it. What is it that you're gonna do to make me participate? People like,
So that's a great question and a great point. So to engage people in precision medicine research, we are giving these talks in the community during the month of April to explain what is precision medicine, what does it mean to be involved in that research, and how to be involved in that research. So it's not a class, but just a seminar, and then a question answer with the audience. But we can certainly consider building something more like a workshop if people are interested in coming to that to learn more about research participation. Then what I'm doing with the exercise trial is going to different community locations, hospital partners, and also giving a seminar, an overview, taking questions and asking people to fill out a questionnaire about what they think are the barriers, would they be interested in participating in this. So getting their feedback while explaining what does it mean to join this study, how long is it, what are the commitments. So we would explain all of that in these seminars.
Here we are again, just talking about research and studies that need to engage the communities and have them participate in ways that just start to increase participation rate. Can you tell me exactly what does all of us have done to engage the community?
Absolutely. So all of us is partnering in the community, bringing awareness to the people through a variety of engagement activities. So they developed these with a community advisory panel, local members that help them with strategy and materials. And they're having community conversations in a variety of venues. This includes churches, senior centers. They're participating at community events by having a table there, in civic groups, and also ads in multicultural TV networks, cable access programs, libraries, and of course ads on the radio, subways, and a bus. So they have the Journey bus that's bringing the program to the local communities in May. On May 24th, they'll be at the Boston Public Library, where participants can experience a hands-on activity, learn more about precision medicine research in general, and have an opportunity to enroll in All of Us. And to learn more, you can see the radio, bus, train ads, or you can also visit joinallofus.org. And Cheryl McLeod is the director of their community engagement program, and she's available and happy to answer questions one-on-one. And it should be a two-way conversation. So All of Us really wants feedback from the community and wants to collect that feedback and help improve the participation and the study going forward. So any questions, contact Cheryl McLeod.
And again, thank you so very much. You've been a very good audience, and definitely they will be here to answer more questions. And please stay away from me because I don't know any of the answers. No, I'm kidding. Good night.
Thank you.
What is health research? Health research helps us find new ways to treat and cure diseases. Health research helps all of us live longer, healthier lives. And while we've been able to discover so much, we can still do better. Let me give you an example. Imagine you were looking for something in the dark with a candle. You'd probably find it eventually, but wouldn't it be easier if you had 1,000,000 candles? The same is true for health research. The more data we have, the quicker we can find what we're looking for. Enter the All of Us research program. We want to help advance health research by creating a large health resource. How big? 1 million people big. By having access to the data of 1 million people, researchers can discover more about our health, and the possibilities really are endless. Here's where you come in. By sharing information about your lifestyle, environment, and biology, you can help empower the medical research of the future today.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better, until now. Enter all of us, the research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1 million people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1 million people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
The All of Us research program is an ambitious effort to gather health information from 1 million or more people across the U.S. Researchers will be able to use this information to uncover new, more precise ways to prevent and treat disease and to keep people healthy.
If we delve deeper into where we live, what we consume, what we do, that will have an impact on trying to prevent diseases in the future.
Precision medicine will allow us to get the right medicine at the right time for the right person.
Diabetes, high blood pressure, obesity, illnesses that Black women get and die from needs to be researched.
This isn't going to be some sort of Tuskegee experiment. This is going to be the community working together with healthcare institutions